My name is Sarah. I'm a nursing student. I'm going to be completing a head to toe assessment today. It looks like the doctor put in an order for that. Can I have you verify your first and last name as well as date of birth?
Thomas Vanderwall, 22397.
Okay, perfect. Thank you. So I'm going to go ahead and wash my hands, and then I'm going to provide some privacy, and then we'll get started, okay?
Okay.
Washing my hands. I'm going to go ahead and close this curtain here for some privacy. Alrighty, so I'm going to go ahead and start with a neuro assessment. So just looking, your appearance seems well. You appear well groomed, which is good. You appear to be in a good mood. Orientation, or for your level of consciousness, I would state that you're alert. I'm able to carry on a conversation with you. It doesn't seem like you're drowsy at all. It doesn't seem like you're struggling at all to produce your words, so that's good. I'm gonna just test for your orientation just to see how that is. So can you tell me why you're here today and where you are?
Yearly checkup, and I am at the hospital.
Okay, and then do you know what holiday is coming up?
Halloween,
Okay, and then can you tell me roughly what time it is?
uh, 9 p.m.
Okay, perfect. So then I'm just going to have you tell me the time on this analog hand watch.
Almost quarter after 9.
Okay, all right, good job. So then what we're going to go ahead and do next is I'm going to move on to your head, ears, eyes, nose, and throat. So for that, I'll start off with just your head. Overall, it appears to be symmetric. Your head is normocephalic, so that's good. That's what we like to see. Just by looking and inspecting, I don't see any lesions. I don't see any lumps. Your hair is very well maintained. You have good hygiene, so that's good. I don't see any lice or anything like that. Is it okay for me to touch?
Yes.
Okay. Okay, and I didn't feel any lumps or lesions when I was palpating either, so that's good. So then next we'll go ahead and we will move on to your eyes. And regarding your head, have you ever had any headaches? Okay, and did your family have any history of migraines or any kind of brain cancers, brain tumors, anything like that? Okay, all right, so then I'm gonna go ahead and get my flashlight out. Do you have any problems with your vision? Have you had any changes to your vision in the last month? Okay, and then do you currently wear contacts or glasses? Okay, all right, so then what I'm gonna do is I'm gonna take my pen light and I'm just gonna shine it in each one of your eyes and check the diameter of your eyes, okay? All right, so start with your right eye. Okay, so your pupils are round, they're reactive to light. I would say they're about a size 3, which is good. Your irises are blue, so that's good as well. Your sclera is white. I don't see any kind of pinkness. I don't see any kind of yellow tinge, so that's good as well. I'm just going to go ahead and next check below your sclera on the outside. Okay, and those are good as well. Those are pink, they're moist. That's good. That's what we like to see. And then next what I'm going to do is I am going to go ahead and check a couple of your vision fields. So I'll have you stare at this pen light right here at the tip. And now I'm going to move it in. And I want you to just follow it with your eyes, okay? Good. So then same thing. I'll have you follow this with your eyes, okay? Okay, so you are tracking appropriately, so that is good. And then the next thing that I'm going to go ahead and do is I'm just going to feel for one of the joints that's in your head, and then I'll feel for your lymph nodes as well. All right, and again, is it okay for me to touch? Okay. So just starting here, feeling for your temporomandibular joint. That's right there, and I don't feel any lesions. I don't feel any lumps or masses, so that's really good. So then I'm going to move forward to feel your lymph nodes. I'm going to start right around up here for your pre-auricular, post-auricular, occipital, tonsillar, and then the submandibular, submental, and then subclavicular. Subclavicular is down here, so there's your subclavicular. Okay, and I didn't feel any of your lymph nodes, so that's actually good. That's what we would expect. That's a normal finding. And then, so I will move on and check your neck strength. So what I'm gonna do for this is I'm gonna place my hand next to each side of your face, and I'm gonna try to push away and push my hand away, okay? All right, so we'll start with the right side. Go ahead and try to push my hand away. Good job. Okay, now we're gonna do the same thing on the left side. Okay, good. So your strength is equal bilaterally and it's strong, that's good. I also didn't notice any kind of jugular distension on the right side or on the left side. Again, that's a normal finding and that's something that we would hope to find and expect to find, okay? So then next I'll move on and I'll feel for your carotid arteries. So I'm gonna go ahead and feel. Okay, so your carotid artery on the right side is strong. I would rate it a 2 or +2, which is normal. So I'll go ahead and feel on the right side. Okay, same thing. So that one is also strong, and I would rate that as a +2 as well. So the next one I'm going to do is I'm going to listen to the carotid arteries just to make sure that there's no bruits present, okay? Okay, good. I didn't hear any bruits, so that's good. That would be what we would expect to find. So then we will continue moving on. I'm going to go ahead and check for your ears now. So I'm just going to peek inside of them with my flashlight. Make sure that there's no drainage, make sure that there's no damage on the inside. Okay. And then I'm going to feel for this ear. Is that okay? All right. So just checking your auricle and your pinnacle. Okay. Any pain? Okay, good. All right, same thing on this side. Okay. And then I'm going to palpate this side as well. Okay, any pain or tenderness? Okay, good. So then I didn't see any drainage, so that's normal. Your ears are symmetrical and they're equally placed. So the next I'm going to do what's called a whisper test. So for this, I'm going to whisper 3 words into your right ear, and I'm going to have you repeat them back to me. And then I'm going to whisper 3 words into your left ear, and again, I'll have you repeat those back to me, okay?
Today is Monday.
Okay, good job.
Tomorrow is Tuesday.
Good job. Okay, so then your hearing is good for that. You're able to repeat the words back to me, which is good. So then next we're gonna go ahead and move on to your mouth, and I'll just use my flashlight, just like I did with your eyes and your ears, and I'll just take a peek inside, make sure everything looks normal, okay? I'm gonna start on the outside, looking at your lips. They are pink and they're moist, so that's good. The teeth are intact. I don't see any lesions, I don't see any dental caries, I don't see any kind of dental impairment. Your tongue is moist and pink. Can you go ahead and lift your tongue up for me? Okay, buccal mucosa is also pink and moist. And then one more time, I'm just gonna have you say ah for me and open up really wide, okay? Good, okay. All right, and your tonsils are intact, so that's good. So then next we're gonna go ahead and look at your nose. And I'm gonna look inside of your nose with my flashlight, just to make sure that there's no impactions, make sure that there's no deviations or anything like that, okay? Just looking from the outside, it looks like it's very symmetrical. It's evenly placed on your nose. I don't see any apparent deviations, so then I'll go ahead and take a peek inside now. Again, no nasal deviation, so that's good. What I'm going to do next is check for the patency in your nose. So if I can just have you plug one nostril and then take a deep breath in and exhale. Perfect. So that nose is patent, or that nair is patent. So we're gonna check the other nair. So I'll have you plug the opposite side. And then again, same thing, inhale, and then exhale. Good. And that nair is patent as well, so no concerns there. So then next I'm just gonna test your scent and make sure that you're still able to smell. So I'll be right back, okay? Okay, so I have a scent here. It's an essential oil. I'm gonna have you close your eyes, and then I'm gonna put this underneath your nose, underneath your nostrils, and then I'll have you smell, and I'll have you tell me what smell you identified, okay? All right, go ahead and close your eyes. Perfect. Okay, and what smell did you think that was?
Vanilla.
Good, yep, that was vanilla, perfect. Okay, so we're gonna go ahead and move right along. So next would be your chest. So we'll move down onto your chest. Before I get to your chest, I do have a couple more questions that I'd like to ask. Do you currently feel safe at home?
Yes.
Okay, have you had any thoughts or concerns with suicide?
No.
Okay, all right, then I will move on to your chest. Any chest pain or palpitations? Any trouble breathing?
No.
Any pain with breathing?
No.
And then any history of any kind of family illness regarding the lungs or the heart?
No.
Okay, so I'm gonna move right on. So I'm actually first I'm just gonna go ahead and inspect. And just looking at it, your chest appears to be equal bilaterally. I don't see any lesions, I don't see any lumps, I don't see any discoloration, so that's good. Is it okay for me to touch to feel temperature? Okay, temperature is equal bilaterally. Temperature is warm, that's good, that's what we like to see. And then next I'm gonna go ahead and listen, and I'll listen to your lung sounds, and then I'm gonna listen for your heart sounds, okay? I'm gonna start with the lung sounds, okay? Sorry, every time you feel my stethoscope on your chest, go ahead and take a deep breath in and out, okay? Okay, very good. Lung sounds were normal, so that's good. I'm gonna go ahead and listen to your heart sounds now, okay? Let's start with the aortic area. That's pulmonic. Dr. Herb's point. Tricuspid. Okay, heart sounds were normal as well. I could hear the S1 and S2, and it was a solid lub-dub sound, so that's good. That's a normal finding, and that's what we would expect to find. So then next I'm going to go ahead and move on to your posterior chest, and just make sure that your lung sounds are fine back there as well. And then I do have a couple more tests that we'll do once we get to the posterior side, okay? All right, so I'll have you turn your body this way. There we go, perfect. And I'm just going to sit behind you to take a quick listen. So just looking, your back looks to be symmetric. Your spine is in line, and I don't see any kind of deviation with your spine, so that would be a normal finding. Your skin is even toned with the rest of your body, and it also does not have any lesions or any lumps, lacerations, so that's good. Is it okay for me to touch to feel the temperature?
Yep.
Okay. Okay, so the temperature is equal bilaterally and it's warm on both sides. So that's a normal finding. So then next I'm gonna go ahead and listen to your lungs. Same thing as with the front. Every time you feel my stethoscope, go ahead and take a deep breath in and out for me, okay? If you feel any pain or any lightheadedness, dizziness, anything with the breathing in and out, let me know and we can go ahead and stop or take a break, okay? Okay, so normal bronchial sounds were heard on both the front and back, so that's good. That's a normal finding. I didn't hear any wheezes, I didn't hear any stridors or any crackling, so that's also a normal finding. So then next what I'm gonna do is I'm just gonna check to see if your lungs fill equally on both sides. So I'm gonna place my hands on your back, and then I want you to go ahead and take a deep breath in and out for me. Okay, and that did inflate and deflate equally. So the next I'm gonna do a check just to see that there's no, that there's equal vibrations all along your lungs. So I'm gonna place my hands on your back. When you feel my hands, I'm gonna have you say the phrase 99, okay?
99, 99, 99, 99.
Okay, very good. So then the vibrations were felt in all 4 locations. That's good, that's a normal finding. That's what we would expect to hear. So then I'll have you face this way. And next we're gonna work down onto your abdomen. So I'll actually have you go ahead and lay down, and I can actually, let me grab a pillow. That way you're a little bit more comfortable. So I'll have you go ahead and lay down on your back for me. And then regarding your abdomen, have you had any changes to your bowel habits?
Nope.
Okay, any constipation or diarrhea?
Nope.
Okay, any pain with urination? Okay, all right, so then I'm just gonna inspect first. And inspecting it, looking at your abdomen, it appears to be normal. It appears to be symmetric and equal. I don't see any lesions, I don't see any lumps, I don't see any kind of bruising or discoloration, so that's good. I don't see any vein distension, so that's also good. So the next I'm gonna do is I'm gonna go ahead and auscultate, so I'm gonna listen with my stethoscope in 4 of your quadrants to listen for bowel sounds, and then I will listen at towards the center of your belly just to listen to bruise in one of your arteries. If you feel any pain or tenderness, let me know, and again we can take a break or we can stop, okay? So I'm gonna start in your right lower quadrant. Bowel sounds are a little hyperactive, but if you've just eaten recently, that could be something causing it. So that's okay. It's not concerning hyperactive, so that's good. And then next, I'm gonna go ahead and listen in for that bruit that I mentioned earlier. Okay, and I didn't hear a bruit, so the next I'm gonna go ahead and palpate. Again, if you feel any pain, any tenderness, let me know and we can take a break, okay? All right, so I'm gonna start again in the lower quadrant, lower right quadrant. Moving on up. Okay, any pain or tenderness?
Nope.
Good, and I didn't feel any masses, I didn't feel any lumps or lesions, so that's good. So then lastly, what we're gonna do is I'm gonna go ahead and percuss your stomach. So to do that, it's kind of similar to what I did on your back. It's just gonna be, I'm gonna place 2 fingers down in a quadrant, and then I'm gonna tap on them, okay? And this helps me know if a space is solid or if it's hollow, okay? Okay, so that is good as well. So then you can go ahead and sit up if you'd like. And then I'm not going to do a rectal or a genital exam today, but if I was going to, mostly what we would want to do is we want to inspect the skin, just make sure that there's no lesions, no breakdowns of the skin, no masses, no lumps, and then we'd also want to check the rectum for any kind of hemorrhoids or anything like that, okay? Alrighty. So then next we're going to go ahead and move on, and we're going to move on to your upper extremities. So I'm just going to palpate any pain or tenderness in any of your muscles. Okay. So then I'm going to go ahead and start feeling on your shoulders first, and I'm going to check for what we call crepitus, and I will let you know if I find it, okay? So again, just going to touch your shoulders. Okay, and I don't feel any bubbling or crackling that I would expect to find in crepitus, so that's good. So then I'll move down and just feel for the muscles in your arms. Just make sure that those are normal. Make sure that there's no lesions, no lumps, no bumps, that kind of thing, okay? Now feel bilaterally. Okay, so your muscles appear to be intact bilaterally, so that's good. And then next I'm going to go ahead and feel the temperature on your arms, if that's okay. Okay, and your skin is warm bilaterally. Again, looking at your arms, I don't see any lesions, I don't see any bumps, I don't see any lacerations, anything that would be cause of concerns. So then I'll move on to your fingers. If you can stick your hands out like this for me, I'm going to check your capillary refills. So to do that, I'm just going to pinch your 2 pinky or your 2 pointer fingers, excuse me, and I'm going to see how long they take to refill, okay? So I'm going to do them individually just so I can really get a good look. Okay, same thing on this side. Okay, and capillary reflex is good. They are equal bilaterally and they refilled in less than 3 seconds, which is good. And then next what I'm going to do is I'm going to feel for the pulses in your upper extremities. So I'm going to feel your brachial pulses and then your radial pulses, okay? And then if you can go ahead and stick your arms out for me. I'm going to feel bilaterally, so at the same time. Okay, those ones are good. Bilaterally, I would rate them a 2, a +2, so that's good. That's a normal pulse. I'm going to feel a radial pulse. I might have to just slide your watch up a little bit, but I think I can make it work. Yep. Okay, and those pulses are equal bilaterally, and again, bilaterally, I would rate them a +2. That's good. That's another normal finding. And then next I'm going to go ahead and check the range of motion in your upper arms. Well, we're already working in the upper arms. So I'll have you hold your arms out like this for me. And then I'm going to have you do what we call flexion. So I'll have you bring your arms up to your shoulders. Good. And then extension, we'll bring them out. Perfect. And then with your wrists, can you bring them out like this? And just lift them up. Come back down. And then do a circle with them. Perfect. Okay. So range of motion was solid and strong bilaterally. So that's good. That's what we would expect to find. So then next what I'm going to do is I'm going to go ahead and check for the strength in your hands. I'm going to have you grab my 2 fingers here and squeeze both sides. Okay, strength is equal bilaterally, so that's good. And then next we're going to do a push and pull exercise. So I'm going to have you hold your hands out like this. I'm going to push my hands down a little bit, try to push my hands away, okay? Okay, good. Strength is bilaterally equal and it's strong bilaterally, so that's good. And I'll have you put your arms or your hands like that. And then I'm gonna push up. I want you to try to push down away from my hands, okay? Okay, good. All right, so strength is equal bilaterally as well for that. And that's good. That would be a normal finding. That's what we want to see. And then I'm going to check your arms for edema and see if there's any edema or swelling. So I'm just going to feel. I'm just going to have to poke a little bit if that's okay. So no edema present in the upper extremities, so that's good. I would say it's 0 because there is no edema. We don't see any pitting, so that's good. Next, what I'm going to do is I'm going to go ahead and check for your turgor. So I just need to pinch a little bit of skin up above your clavicle, okay? And it shouldn't hurt. Okay, good. That was great. There was no tenting, so that's good. That means that you're fully hydrated, your skin is bouncing back, so that's good. That's what we would expect to find. So then next I'm going to go ahead and move on to your lower extremities. And it's going to be very similar to the upper extremities, but there's a couple of things that are a little bit different. Okay. All right, so I'm going to start off with the pulses. So I'm not going to feel the femoral pulse, but if I was going to check the femoral pulse, it would be just up above the groin area. Okay. All right, so then I'm going to start with the popliteal pulses, and those are just behind your knees. So I'll do the right leg first, and then I'll do the left leg, okay? All right. Okay, that's strong on the right side. I would rate it a +2, so that's good. Moving on to the left side. Okay, that is also strong, and I would rate that one a +2 as well, so that's good. Before I move on to the veins in your, or the pulses, excuse me, in your ankle and your feet, I'm going to go ahead and check the temperature on your legs as well, similar to what I did on the upper arms. So I'm just going to touch, feel the temperature. Okay, temperature is equal bilaterally, and it's warm, so that's good. And I don't see any lesions, I don't see any lumps, I don't see any skin discoloration, and I don't see any vein distension, so that's good as well. So the next I'm just going to poke again, just to check to make sure there's no edema present. Okay, so that's normal, no edema. It's slightly soft, but not edema soft, so that's good. So bilaterally, no edema is present. So then what I'm going to do is I'm going to go ahead and feel for the pulses in your ankle first. Okay, we call those the posterior tibial. And those are on the insides of your ankles. And I can feel those ones bilaterally. Okay, good. So those are strong bilaterally. I would rate those ones a +2 as well. So then I'm going to move on to the dorsalis pedis, which is on the tops of your feet, okay? Okay, those ones are also strong bilaterally, and then I would rate them a +2 bilaterally. So that's good. So then next I'm going to do is stand up. And then we're just going to do a couple of exercises on your feet as well, similar to what we did on the upper arms. And then, so for that, I'm just going to have you lay back one more time for me. Okay, so what I'm going to have you do first is I'm going to have you raise your leg all the way up and then put it back down. Same with the other side, raise it straight up and back down. And then I'm going to have you take the heel from your right foot and drag it along the shin of your left foot. Okay, and then I'll have you repeat that on the other side. Very good. And then I'm going to go ahead and check the strength of your feet. So what I'm going to do is I'm going to place my hand underneath your foot. I want you to try to push my hand away, okay? And I'm going to do that bilaterally. Okay, go ahead and try to push. Good job. Okay, so strength is equal bilaterally. I don't see any issues with that. You were able to push away both of my hands equally, so that's good. So then you can go ahead and actually I'm going to check your sensation really quickly while you're still laying down, just so that way you're more comfortable. So I will let you feel this on your hand. So it's going to be a sharp and dull. This is what sharp feels like. This is what dull feels like, okay? So then I'm going to check that on the bottom of your feet. Once I do it, I'm going to have you go ahead and tell me if it was sharp or dull, okay?
Sharp.
Good job. And then
Dull.
good job.
Sharp.
Yep.
Dull.
Very good. So then go ahead and sit up for me. Okay. And then I'm also going to check the sensation in your face. Normally this would be a part of the head assessment, but I did not do that, so I'm going to do it now, okay?
Okay.
So then same thing, same concept as with your feet. Perfect, you already have your eyes closed. That's what I was going to say next. So then you already know what the sharp and dull feels like. Do you need me to repeat that? Okay, so then go ahead and close your eyes. Same thing as with your feet. I'm going to go ahead and put part of it on your face. Tell me if it's sharp or dull, okay?
Sharp.
Yep.
Dull.
Yep.
Sharp. Dull.
Yes, very good. Very, very good. Okay, so then next we're going to go ahead and look at your neuromuscular assessment. So I'll have you stand up for me for just a second. And then I'll have you step right over here. Face this way for me. And I'm going to have you take about 3 steps forward. Okay, and then I'll have you turn around and do the same thing. Good, perfect. Okay, so I'll have you stand right in front of me, and we're going to do what's called the Romsberg effect. So what I'm going to have you do for that is in just a moment, I'm going to have you close your eyes, and then I'm going to have you put your arms straight out to the side.
Okay.
Just to check your balance and make sure that all of that is normal as well. Okay? All right, so then go ahead and close your eyes and lift your arms. Very good. You can go ahead and put your arms down and open your eyes. So that was normal. So then the next thing that I'm going to have you do is I'm going to just check to make sure that you're able to follow my finger. So I'll have you take your finger. I'm going to have you touch your nose, and then I'm going to have you touch my hand, and then your nose, and then my hand, okay? All right. Go ahead and touch your nose and my finger. Nose, finger, nose, finger. Very good. Okay, so then you can go ahead and take a seat. We're all finished with that. Okay, so then what I'm going to do next is I'm just going to check your plantar reflexes. You might have also heard this called the Babinski reflex. It's very common in newborns, but in adults it's where typically we wouldn't want to find it, okay? All right, so then I'm going to have you go ahead and uncross your feet for me. Okay, and then I'm just going to lift one of them. I'm going to draw a J on your foot, and then I'm just going to watch for how your feet turn. Okay, negative for Babinski in that foot. And then we're going to do the same thing on this side. And negative for Babinski in that side as well. So that is good. That is a normal finding. So then we're going to check range of motion on any joints that we might not have checked. So I'm going to have you go ahead and take your feet, and if you can, what we're going to do is called inversion. So I'll have you rotate your ankles and your feet inward. Good. Good. And then if you're able to, I know it might be difficult because you're sitting, but if you're able to bend your knee. Good. Okay, and then another one. Okay, so you have range of motion in your lower extremities. We already checked for your upper extremities, so that's good. And then another thing that I'm going to do, again, this would typically be done in the facial assessment, but just to make sure that we cover it, I'm going to check your sinuses. So I'm going to press on a few spots on your face. If you feel any pain or tenderness, please let me know, okay? Okay, any pain or tenderness with that? No? Okay, good. So sinuses are good. So then that's going to complete most of our physical assessment. So the next I'm just going to go ahead and do some education. I did see that you had a couple moles, which are totally fine. It's normal to have some, but I did just want to go over some education on skin assessments. for if any of those moles change. So what I'm going to discuss today is the ABCD of skin cancer. Are you familiar with that at all? Okay, so the A actually stands for asymmetry. So what that means is how does the mole or wart or the skin lesion in question, how does it look? Is it equal? Is it a full circle, or is maybe like half of it really rounded and then the other half of it kind of wavy and crazy? That's something that you'd want to pay attention to because that is an abnormal finding, and that's something that you might want to present to your doctor. If it's just slight, it's not anything serious, but if it's crazy and lots of asymmetry, then that's definitely something you want to talk to your provider. Next is B, and that's the border. So if the border of the mole is bumpy or raised, or if it's kind of crusty, that's also an abnormal finding, and that's something that would want to be, again, brought up to your provider. C is the color. If the mole is brown or tan, that's fine. There's a lot of different colors that moles can be that can still be normal. However, if they're blue, if they're white, or if they have a shiny hue to them, that's an abnormal finding. That's something that you'll want to bring up to your provider, okay? So then next, moving on, is the diameter. So if you have a mole that's kind of small, that's fine. But if you have one or have any kind of lesion on your skin that's bigger than a pencil eraser, that's abnormal, and that's something that you'll want to bring up to your provider because that's not something that we typically see. So again, if it's bigger than a pencil eraser, bring it up to your provider. And then lastly is E, which stands for evolving. So if you notice a mole that's changing, maybe last week it was brown and this week it's kind of white, that's something you want to bring up to your provider. Any changes, whether it's changing in size, whether it's changing in shape, whether it's changing in color, any changes that appear, that's something that you want to bring up to your provider as well, okay? All right, and then any questions for me today?
Nope.
Perfect, and then are there any questions that you want to bring up to the provider or talk to the provider about?
Nothing I know.
Okay, perfect, and if you think of any, feel free to just let us know, okay?
Okay.
All right, that's going to complete your assessment today. So I will go ahead and let the provider know that you're ready, and then they'll be in shortly, okay?